This means that 146 cases have now been identified in our province. We suspect up to 8 of these cases are community transmission, although we have information only on 7 and are waiting for confirmation of the 8th. 2 individuals are receiving care in ICU, which we have announced previously. I must also sadly report the first death from COVID-19 in our province. This individual was admitted in the ICU in the Edmonton zone on March 12th and passed away late yesterday. This patient was a male in his 60s with underlying medical conditions. This is extremely sad news, and all of us involved in Alberta's COVID response feel this very deeply. All of our thoughts are with this man's family and loved ones. AHS assures me that they are supporting them in this difficult time. As heartbreaking as this news is, it was expected. This is a dangerous virus. While most people who become ill with COVID only experience mild symptoms, it can make others very sick. We only have to look at other countries to see how serious it is. It has been reported that Italy has just surpassed China on COVID-19 deaths. I know that this news is frightening and will add to people's anxiety. We are doing all we can to fight the spread of this virus. This is why we have taken the extreme measures we have. We will get through this, but to do that, we need everyone's help. Take this seriously. Stay home unless it is essential for you to go out. Now is not the time for social gatherings. Practice social distancing if you do not have to go out, including if you have to work outside the home. Sorry, let me say that again. Practice social distancing if you do have to go out, including if you have to work outside the home. If you are struggling with today's news, reach out to friends and loved ones and talk. Tell them how you're feeling. Today's sad news is precisely why we are taking aggressive measures to reduce the spread of COVID-19. The restrictions we have put in place on mass gatherings, the closures of public recreation facilities, and the limitations on restaurant capacity, these are all efforts to protect the public's health and prevent spread. I urge you to take these measures seriously and do your best to limit your social interactions and practice social distancing. To assist Albertans, we have launched new resources online on social distancing to try to make things easier. If you were wondering what steps you should take while grocery shopping, riding an elevator, or going to a restaurant, go to alberta.ca/COVID-19 and click Help Prevent the Spread in the Prevent and Prepare section. Some social distancing tips include shopping during off-peak hours, like first thing in the morning or late at night, wiping down baskets and shopping carts before and after using them, sanitizing your hands when you get off the bus or train, using utensils if you are eating out rather than choosing finger foods, and avoiding open snack dishes such as peanuts or candy. These are simple tips that can help us all flatten the curve and prevent the spread of coronavirus. I have heard concerns about compliance with the public health orders we have issued to close certain facilities and limit the capacity of others. If you have concerns about an establishment, please do not call 911. I have been hearing reports of this happening, and we must leave this line open for true emergencies. We are working with Justice and Solicitor General to develop a process for responding to these concerns, and we will provide an update when we reach a solution. I want to again extend my condolences to those who are grieving the loss of their loved one due to COVID-19 today. We have put aggressive measures in place to prevent the spread of this deadly infection and protect those who are most vulnerable to make the number of these tragic occurrences as small as possible. These measures are hard on all of us. I urge you to take them seriously. We must continue to stand strong together, even if from a distance. So, the virus can be very mild for some people, and for others it can be fatal. And so I think that's part of the challenge that we have, is that when people hear statistics like 80% of people who get the virus have a mild self-limiting illness, I think for some people that fact is something that sticks in their head as a reason to not take it seriously. But the challenge is that even for those people who might have a mild self-limiting illness, If they spread it to others, then even if they themselves aren't directly impacted, they could be impacting others. And we can't tell for sure. We know that people who are older, have medical conditions, have higher risk of severe outcomes and death. But as I've said before, sometimes younger people can still have severe outcomes and death. So this is not something to be taken lightly. Yes, many people who get it will have no more than sort of a mild cold, a few days of fever. But if they spread it to others, that chain of transmission can cause deaths, ICU admissions, hospitalizations. So again, we're all in this together, and this virus should not be taken lightly.